Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/MBO. Terms and conditions apply.
Man, you are one pathetic loser.
You get nothing. You lose. Good day, sir.
I am too smart. I am too smart. I am too smart. I am too smart. Esta Marchi.
And though you will try to always get it right, the beauty of life lives inside of you. And I hope someday you find it too.
You've heard all the ads, and seen the shops for CBD, and maybe you've wondered, what's the hype? Cannabidiol is known for its ability to provide non-habit-forming relaxation, and now you can have it in a convenient nasal spray. You can take it anywhere. Just go to simplyherbals.net. That's simplyherbals.net. And check out Dr. Scott's Buffered Saline CBD nasal spray. Just a couple of toots. You'll see why he's America's top CBD nasal spray. While you're there, check out his line of supplements from fatigue reprieve to stress less. Dr. Scott has it all. That's simplyherbals.net. Simplyherbals.net.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown Tacie City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred with the way wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And Tacie's here in the studio. Hello, Tacie. She doesn't have her mic on yet. This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. And come join us with the Fluid family. Amanda Davidson is our primary moderator over there. I got to hang out with Amanda at the WATP event. She's quite delightful, and she was a big help in particularly setting out my dumb crap. She knows how to do it, and I just throw everything out there. So
she is organized.
Like, no, do it this way.
Yes, good.
So anyway,
thank you, Amanda, for doing that.
Yes, thank you, Amanda. You're the best. And check out roadie.drsteve.com for the Roadie robotic tuner. And it's roadie.drsteve.com. Check out Dr. Scott's website at simplyherbals.net. And patreon.com/weirdmedicine. I'm putting content up there again.
Okay.
So what I'm doing now is anyone who is a Patreon member can hear the after show where we play stupid music and banter and talk to people about stuff in the chat room. So check that out, patreon.com/weirdmedicine. Plus, we've got the exam room where we have celebrities call in and ask us questions. I'm going to do that again. And a couple of live streams, stuff like that. It's all, for the most part, stuff you can't get here. Oh, and our Dave Landau stuff is direct links to the Dave Landau Ask Dr. Steve things.
Okay.
And then cameo.com/weirdmedicine. I'll say, what up to your mom or whatever. Check out Dr. Scott's website. It's simplyherbals.net. And check me out on Normal World with Dave Landau. We're doing Ask Dr. Steve. I got to play one. I got to see it in front of a live audience, what the reaction was when we were at in Largo, Florida, at the Who Are These Podcasts live event, which was wonderful, by the way. And it's so funny how, there's all these people say, Carl only sold 13 tickets and all this stuff. I mean, it was a huge theater, and it was 2/3 full.
Oh, wow.
So,
That's
it was
good.
fine. There were a lot of seats in the back, but that was good for me because I wanted to take some pictures from back there, and I wasn't bothering anybody. But
right on.
It was, we had a VIP meet and greet, which is hilarious. I mean, if you're me at one of these things, you ain't no VIP. But
were you one of the VIPs?
Yeah. I had my own little table and was giving away weird medicine tchotchkes, like key rings and stuff like that. It was fun. Signed some posters. And, there were quite a few Opie and Anthony fans there that say, I've been listening to you since, 2005, which is pretty cool. So, particularly since we started in, 2007. No, I'm just about, I think my first appearance on Opie and Anthony was 2005.
Meanwhile, Tacie's at home making poor decisions without a chaperone.
Yeah, let's talk about that.
Well, I don't think we need to talk about that necessarily. However, there were wounds and...
Okay, so Tacie was helping her friend down the front steps.
Which are dangerous.
And right, because they're steps. And they had a couple of drinks too many or whatever. Her friend did. And her friend fell on Tacie and I guess mushed your leg between her and the stairs. Is that what happened?
Yes, but then the others, and my hip is all scraped up too.
So she has this giant hematoma on her lower leg. Mm-hmm. So we wanted to talk to you for a second about kinesiology tape.
Sure.
So she was at the gym, and these people practicing medicine without a license went ahead and just threw some kinesiology tape on there saying, this will make the bruise go away. I'm struggling to find out what the mechanism would be, other than it's putting some external tension on the area.
Yeah, I don't
you're
know
the sports guy.
Yeah, no, I'm a huge fan of kinesio tape, but I'm a huge fan of kinesio tape when you have an injury or somebody has some tendonitis in their elbow. You put some kinesio on there, but for a bruise, I'm not so sure. I was kind of shocked not to just see some arnica, arnica hair on there.
Sure. Or nothing,
and just let it run its course. But right. I don't know why the kinesio tape is going to help kind of with just hold tension to the surface tissue and the fascia underneath.
Right.
But I'm not so sure why you would want to do that when you're trying to get rid of a bruise.
Right.
Well, we shall see how it works. They told me to come back in a week.
God, you know how long hair on your legs is going to be in a week. It's going to be
that's
actually
true.
That's going to be awful.
The older I get, the less hair I grow, so it won't be bad.
No,
okay.
The number. Well, I was going to say.
Ahead.
My number one thing, any kind of bruise like that, topical arnica. Arnica is something they use in a lot of dermatology and vein clinics, and it's a natural anti-inflammatory and great for bruises.
I am going to give you and me both one of these.
What?
So now this is from Elevate Sport and Spine Therapy. This isn't a study. It says one of the best ways to get rid of a troublesome bruise quickly is to put kinesiology tape on it.
Oh, my gosh.
And now the so kttape.com, which is obviously biased. So we're going to do we're going to look and see if there are any studies on this. Elimination of bruising with kinesiology edema taping technique was likely due to increased action of platelet endothelial cell adhesion molecule, in other words, PCAM1 protein filament. How much lymphatic uptake occurs is largely dependent on how the tape is applied. So what they're implying is that when you put this tape on, it opens up the lymphatic channels, which then draw off the hematoma. So this is their biased approach to it. Let's see if...
I'd have to see a little further studies on that. I really would.
Right.
You know, because the big thing, Dr. Steve, and you know as well as I do, in lymphatic drainage is one of the strangest things you can ever encounter. It's the lightest, most gentle touch that you just barely apply to the skin, and that helps to stimulate the lymphatics. Anything aggressive to the lymphatics can bruise them and actually makes them more sluggish and slows down the movement of the
because they are. It is a circulatory type system, but it has no heart, and lymphatic drainage system is very muscle driven,
right? And gravity driven. Yeah, sure is.
And the vessels themselves. I mean, we never even able to
they're
dissect
passive
them out.
for
Right.
the most.
Right.
I mean, the lymphatics count on all the surrounding tissue, the fascia, the muscle, and again, like I said, gravity. So yeah, I don't.
So I went to PubMed. And here we go. Kinesiology tape modestly increases skin blood flow, regardless of tape application technique. In other words, you don't have to put a fancy pattern on it like Tacie has.
It's
it
cool
looks cool.
looking.
It looks like a fan pattern. It was kind of
she showed it to you.
Yeah, it's kind of cute. Yeah.
Okay, let me see. Forearm skin blood flow after kinesiology taping in soccer players. But is there a single thing? I put in hematoma and bruising, and there's nothing.
No.
So I think they are making some claims that maybe they can't necessarily back up. Although I am, I have an open mind about this stuff.
Oh yeah,
it's worth a shot.
Oh shoot, yeah, absolutely.
Oh, I think it's going to hurt anything.
My friend is using arnica.
Yeah, I would use arnica. Yeah,
for her war wound.
Yeah, she's got quite a wound.
Okay, so for further details. The process, wait a minute, okay, is described in simple terms in an article on my clinic's website. Okay, so very good. There's no citation here whatsoever of where they're getting this from. So I would like to know more about it. And we have a clinical trial with an N of 1. This is Tacie. And the problem is it would really be better if you had a giant bruise on the other leg and we only taped one of them.
Well, unfortunately, the bruise on the other leg is combined with a giant scrape.
Yeah.
So they can't tape
But it would have been cool if we had a control.
Yeah.
Now, what I will be impressed with is that they told you that if the bruise will only go away where the tape is, and then they got to reapply it to the spaces. So they made sort of a lattice.
Yeah.
Now, if you come in next week and where the tape was has no bruising, and where the tape isn't, there's still bruising, then that will be pretty convincing.
They said I should see spider veins of bruise within the next couple of days.
I don't want spider veins.
And
gross.
Yeah, so I don't know. They were like, "Why? How'd this happen?" I'm like, "I'm 50 and I make poor decisions."
Correct. That is true.
That's why we're friends.
So anyway.
Well, I've learned
I'm just
that
lucky
at
I have a
68,
head.
I may need to make good decisions. So, made a couple of questionable decisions when I was at the WATP thing, but there was only a photograph of one of them. So,
damn,
it was
damn cell phones.
Well, I may have performed a lewd act on Royce while he was singing karaoke.
Oh, goodness.
Because it was so amazing. I mean, his karaoke.
Did you get up on a table again and scream?
No, I did not. No.
Not that you could do whatever, and I couldn't say a damn word.
Well, anyway, it was fun though. We had a great time. I highly recommend if you are fans of old O&A stuff and fans of Jocktober that you go to a WATP live event. It was really fun. There's a lot of just like-minded people. One guy got so drunk he got kicked out, and then he's been on Reddit ever since saying that that Carl's alibi is, and I can confirm this, that he was running a show when this was happening. He never left the stage from an hour before the show till about 30 minutes after the show. So that wasn't what happened. But I don't think that the guy could possibly remember what happened.
Oh, goodness.
But that, they serve alcohol, and every once in a while somebody gets overserved. It's not that big.
Well, our babysitter from our kids has agreed to babysit me when you are out of town from the future.
Really?
Yeah.
Okay.
We may have to make her wear a helmet, while we're not here.
Yay! Yay! I'm Tacie.
So stupid.
We're so proud of you, Tace. I love it.
All right.
I love it.
Well, so that was fun. I've done my 4th installment of Normal World, and I'm going April 8th to do the Eclipse coverage for Normal World, and I don't know how we're going to do it. This one is going to be bigger than the last one. Millions and millions of people are going to descend on the path of totality, and they want me to go downtown with this. It's like, you guys are crazy. I've got an expensive, solar telescope that we're going to use, and I've got, the solar binoculars, and I think we could film some B-roll down there, and you all can maybe interview some crazy people. But I think my part needs to be, at the studio where we have control of the surrounding environment. But that's up to them. This is their thing, and I'll do whatever they tell me to do. They're the comedians, not me. So I did have kind of a germ of an idea because, back in the past, and our ancestors thought that the sun was being eaten. And then they would do some ritual, some crazy ritual, and then they'd congratulate themselves because they make the evil, dragon go away, and then they'd go back to doing whatever the fuck they were doing before. So there's got to be some corollary to the catastrophic thinking of today about certain things. Mm-hmm. And but again, that's just the germ of an idea. We'll let them do their thing on that. Mm. Anyway, check out Normal World with Dave Landau. It's on YouTube, also on Blaze TV if you happen to be, on that platform.
When is this eclipse thing?
April 8th, 2024.
Gotcha.
And you can just say, when's the eclipse? You just Google, when will I see the eclipse? And it will come up. It's going from Mexico to Texas. And if you go from Dallas to Maine and draw a line between there, that is the path of totality. So it's really bisecting just about all the
Middle
country.
America, yeah.
I think there are a few places won't get any of it, and it's like northern Washington State or Oregon or somewhere, and those sort of northwestern states won't get as much. But everybody else will get a little bit. Some only 10%, but do not look at the sun and do not use film. We talked about this last time.
Totally going to look at the sun.
Get solar glasses. You can buy them at Amazon. They've still got tons of them. They learned from last time.
Yeah.
And if you have solar glasses from last time, which was 7 years ago, do not use those. They're no good anymore. Gotcha. And people go blind every year with these fucking eclipses.
Oh, gosh.
Well, because... Yeah. They think that they can use their binoculars to look at the sun while the diamond ring is still being viewed. And the only time you can look directly at the sun is when it is fully in totality. If there's any bit of the sun edge showing, you can't look at it. Yep. But you can do indirect viewing with pinhole or just leaves. Or like a colander, just take a colander out and project the sun through it onto a white piece of cardboard, and you'll see little, crescent suns. And then if you're in the path of totality, absolutely look right at it, take pictures, and just remember how long it's going to be in your area. And if you start to see that the side of the sun start to brighten even a little bit, you got to look away again.
Yeah.
All right.
Sounds great.
What is pretty cool, though, if you've got a filter, is you can see the mountains of the moon as they as as second and third contact happen. In other words, first contact's when the moon first touches the sun. Then second contact is when it just before it occludes the sun. Then there's totality. Then third contact is when it's pulling away from the sun, right? And at that point, just as it starts to pull away or go to full totality, you'll see a ring of like a string of pearls around the sun. And it's not even, and that's because there are mountains and valleys in the way. And so you'll see just little bits of sunlight will be visible just before other little bits because the altitude on the limb isn't perfectly, flat. That's pretty cool. Anyway, all right. All right. Let's see here. I had a question here. Oh, yeah, let's do this one. Scott, you can talk about this one, too, because I want to know what the Chinese version of this is.
Uh-oh.
This is from Todd in Las Vegas.
Hey, Dr. Steve, Dr. Scott, et al. This is Todd from Vegas. Got a question for you. I've been kind of dealing with a little bit more of restless leg syndrome. I usually get between 6,000 and 10,000 steps in per day, but I don't really go to the gym all that much, and I'm kind of trying to will myself to do it. I'm wondering if there's either like a medication or if Dr. Scott can maybe recommend a supplement that might be good to use to sort of prevent or curtail the possibility of my restless leg syndrome at night. I do take quite a few supplements. I take magnesium glycinate, mainly because I have a very hard time being able to sleep at night as it is. So any recommendations, greatly appreciated. Thank you very much, sir.
All right.
Yeah.
So why don't you, he asked you first.
Sure.
There's sort of non-pharmacologic things. Do you want me to give sort of just a rundown of what restless leg syndrome is, and then first, or do you want to?
No, I was going to say let's first talk about what it is because it can be pretty complicated.
Yeah. So it's just a condition that causes an urge to move the legs, and it's usually caused by this weird uncomfortable feeling in the legs. People have trouble describing it.
It's miserable.
Usually happens in the evening when they're sitting or lying down when they don't have stimulus. And it can really affect their ability to sleep. The movement eases the discomfort, but then it always comes back. It can happen at any age. Gets worse with age. Like I said, it disrupts sleep. It's also known as Willis-Ekbom disease, but no one calls it that anymore. And the risk factors for having this are hereditary. Some people, at times it runs in families. Pregnancy, if you have iron deficiency or kidney failure, Parkinson's disease, that kind of stuff. So anyway, so there you go.
Yeah, so it sounds like he's taken some supplements already. The number one thing we typically tell people is to try some magnesium at bedtime. But he's already taken the magnesium glycinate, which I prefer. We don't know how much he's taken, and certainly you can take 200. I usually tell people to start at 200 milligrams and go up according to whatever the bottle says or whatever the health provider says. That's certainly something. And I know you're going to talk about tonic water in a second, but some other things.
I'm not going to talk about tonic water on this one.
Okay. Well, and some other things.
Leg cramps, yes, but not so much for restless leg.
Well, and some other things you can actually try if it is related to exercise. If it is related to exercise, he can do some increased stretching after he gets done walking. He's walking 10,000 miles or 10,000 steps a day, which is quite a bit. And sometimes it's just an overuse syndrome. Make sure that he does have good oxygenation. Make sure that his iron levels are normal, et cetera, et cetera, et cetera. But sometimes a massage will make a huge difference. A gentle massage before you go to bed will make a big difference with restless legs if it's from overuse.
Okay,
so that's the first thing I would do.
Yeah. Yeah, I think doing all the sort of lifestyle stuff first helps.
Yes,
and then doing things that help you sleep at night by not don't drink right before you go to bed. Alcohol, don't eat right before you go to bed. All those things. Don't exercise right before you go to bed.
Don't fall down the steps.
Don't fall down the steps. It's true. So let's if all of that fails, then there are pills you can take. Sure. There's some that work on dopamine axis in the brain. One of those is pramipexole. It's sold as Mirapex. And then there's ropinirole. And these are, approved by the Food and Drug Administration to treat moderate to severe restless leg syndrome. The thing is that they're great drugs, but every once in a while they'll they'll mess with your impulse control, and people will all of a sudden start compulsive gambling on these things.
Oh, wow.
Because, dopamine's involved in the whole pain and pleasure thing in the brain, et cetera. So, and they can make you sleepy during the day. And then sometimes they'll work for a while, then they'll just quit working altogether. Now, there are other medications that I prefer to use for this affecting calcium channels. And those would be gabapentin and pregabalin are the two main ones, Neurontin and Lyrica, and those will work for some people. And the nice thing is gabapentin is now generic and it's cheap, and so that may work. There are also clonazepam, but it is habit forming, and once you start taking it, you're going to be taking it. And every once in a while, you get somebody that nothing will help them, and some of the physiatrists will use an opioid, low-dose opioid for this, like tramadol or even oxycodone. So, but most of the time we recommend the lifestyle changes, the gabapentins and the pregabalins. If that doesn't work, then I would try the dopamine ones. If that doesn't work, then maybe a muscle relaxer just to help you sleep at night. It doesn't really change the syndrome, but you just sleep better. And then, because that's what people are really concerned about.
Right.
All right. So no Chinese herbs or anything for restless. Surely to goodness they had restless leg syndrome in ancient China.
Yeah, but it's a lot of the stuff that you were talking about earlier, as far as just calming the mind, just helping people go to sleep.
Yeah.
The one formula we have is the stress less, which is what I personally take. Just calms your mind.
What's it got in it?
It's got astragalus, of course.
Of course.
Well, that's because.
Go ahead.
And it's got some oyster
Well, that's because you're an idiot.
It's got oyster shell and some other things.
Yeah.
But they're old Chinese herbs, and certainly before I would go to some of these higher, really a lot stronger pharmaceutical drugs,
right?
I'd find somebody that does some Chinese medicine and try some a little more gentle things, because a lot of times these restless legs are cyclical too.
Yeah.
They will come and go
Okay.
a lot of times. So.
All right.
Yeah, just stick with it. And then make sure there's nothing, there's no stenosis in the lower back, because sometimes if it is related to your lower back, sometimes that stretching again will help, and sometimes maybe an epidural or something like that.
Okay.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/MBO. Terms and conditions apply.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
Did we do? I don't think we did this one. And then we're going to get to your stuff.
This might be a dumbass question here, but what is the difference between a virus, a bacteria, or a parasite?
All right. That's actually a good question. So thank you, Tacie. It's Tacie DeLoach, everybody. A virus. So a virus is a machine, a nano machine made up of DNA and protein, sometimes RNA and protein, that is designed to only affect other cells and co-opt their internal mechanisms so they can make copies of themselves. That's it. There's no effing purpose to these things other than just pure reproduction.
Yep.
And they are just little machines. I mean, look at bacteriophage sometime and see that thing is a designed machine. I mean, it's amazing. It looks like something that Elon Musk would create. Some little nano machine. Now, do they have some uses? Yeah. We can co-opt the damn things and make them deliver drugs or gene therapy and stuff like that. So, when I talk about eradicating pathologic human viruses, I'm not talking about eradicating all viruses because there are some that we can use because we're not quite there yet where we can just design our own virus to do whatever we want. And if we did, I'd be nervous about it because I've seen I Am Legend. So
yes.
I know this shit goes down.
A little concerning, yes.
But anyway, but they're using viruses to deliver, as I said, gene editing to cells. They're using viruses. There's viral oncolytic therapy where you use viruses to mark cells for destruction by the immune system. So if you can target only cancer cells with your virus, then they start expressing their proteins on the surface of those cells, the white blood cells will come in and kill them. They've done this with multiple myeloma with measles virus.
Gotcha.
So just as an example. So those were what viruses are. Bacteria are a little more complex. They actually respire. They take in energy and they expend energy. Some of them have flagella on them that allow them to move. They're motile. And E. coli is one of those. As a matter of fact, I just saw a new catheter that they designed that will keep E. coli from colonizing the catheter and the urinary tract so that it would be a safer Foley catheter.
Oh, wow.
Yeah, it was designed by AI.
Isn't that crazy?
Yeah, and that's something, and it traps the bacteria as they try to work their way up the catheter. Anyway, so but they will have DNA in them, and they also are very smart about learning. Well, some of them are about learning how to become immune or impervious to antibiotics,
right?
Because bacteria and fungi are in a constant battle in the real world. And that's how penicillin was discovered. There was a little fungal colony on an agar plate where someone was trying to grow bacteria, and they saw all around the fungus. It was clear.
Right.
And it was killing all of the bacteria around it to protect itself.
Wow.
And so these things are in a constant battle, but then the bacteria are like, hey, fuck you, we're going to figure out a way to get around this.
We're going to change our protective shield.
That's right.
Yeah.
And they can teach each other, too. Yeah. Once they figure it out, they throw these plasmids out, which are little pieces of DNA that it's just like, if you go on YouTube and you get a recipe from some guy, it's like that. They're throwing out recipes for making yourself impervious.
Make your own. Yeah, make your own. Yeah,
impervious to this particular antibiotic, and so they that's bacteria, and they divide and they sort of reproduce, so there is some mixing of DNA, but it's not sexual reproduction. And then you have parasites, are multi-cell. Viruses, no cells. Right. Bacteria, single cell. And then parasites, by definition, are multi-celled organisms that live parasitically off of us. In other words, they drain resources from us. An example of that would be ascaris or roundworms, where they grow inside of us, but they don't do us any good. No. But they do only themselves good.
Yeah. Is there any research using parasites for new treatments? Like they're using viruses for cancer treatments or bacteria for.
Well, I know people will take tapeworm eggs for obesity. We don't recommend that. No. And remember that story that we had? I think we did it 2 different times. Tacie brought it once and Lydia brought it once about a guy that had a tapeworm. The tapeworm got cancer. Poor little thing. Yep. And then the guy got tapeworm metastatic cancer from the tapeworm.
Golly.
So he had tumors all over his body, but none of them were human cells. They were tapeworm cells, tapeworm cancer cells.
That's a stroke of bad luck.
Yeah, that's definitely unlucky lottery. Anyway. All right. So did we cover that?
Yeah.
Yeah, there you go.
Cool.
All right.
Good question, Tacie.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Hello, everybody.
Hello.
I have 3 topics. I'm going to go through them very quickly.
Okay, wait, you take your time. We've got...
The first one is 10 things you didn't know about the penis. Sent to me by Steve.
What? No, it was sent to you by Stacy, and I forwarded it.
The first erection, even before the moment of birth, ultrasound scans sometimes show a fetus with a fetus with a fully formed erection.
I see why you had trouble with that. Try say penis.
A fetus with a fully formed erection.
On a fetus with an erection.
Yep.
Number 2, a penis is twice as long as you think. A lot of people might take solace in this fact. Penises. God, I cannot say that word. Are longer than they look.
He's got a really long
Penerish.
In fact, around half the entire length is housed inside the body.
That's why some people will measure from their rectum, from their asshole, through the taint, and they'll go, I got 10 inches. Like, no, dude, it doesn't work that way. You got to measure from where it first becomes visible.
Yep.
Stop it.
Number 3, the shoe size myth. Let's lay this one to rest, shall we?
Okay.
There is no correlation between shoe size and penis length.
Okay, well, that makes sense.
Yeah,
what about penis girth, though?
Penile dimensions are significantly correlated with age, height, and index finger length, but not foot size.
Now, okay.
There you go. Now you're in trouble. That's a hell of an index finger you got there, Steve.
I can span an octave and a third. Go ahead, Tace. I'm just throwing that out.
Number 4, morning wood. Most people with penises have 3 to 5 erections every night.
Yeah.
Mostly during REM sleep. Also called nocturnal penile tumescence. And it's not clear why it happens.
I'll tell you
One
what
theory
happens.
is that it might help prevent bedwetting. An erection inhibits urination.
It does.
Yeah.
If you've ever tried to...
That is true.
To urinate with a raging erection, it's very difficult to do so.
Number 5, one final erection. So we've established that erections can occur in the womb and the sleep, but what perhaps even more surprising is the death erection, also called angel lust, and happens in the moments after death.
Rigor mortis is setting in.
It just goes to show you that guys will just get a boner no matter.
Yeah, rigor mortis.
Because we've told this story many times about the guy that was brain dead, and the wife wanted to get some, wanted to have a baby, and so she got him an erection and jacked him off until he completed the transaction, and then she just went on her merry way, and he was brain dead.
Oh, goodness.
So, well, just, guys can be brain dead and still get an
yeah,
erection and still get it on.
Yeah.
I think most of us are probably considered brain dead anyway.
It's not exactly a higher level cortical thinking.
No, that's right. It's not a surprise either.
Number 6, the penis can break. The moment of fracture is accompanied by a popping or cracking sound, intense pain, swelling, and, unsurprisingly, flaccidity.
You hope.
Yeah.
Usually partial flaccidity is what causes it. Do you know what position is the number one position for causing this, Tace?
No, it just says vigorous sex.
Well, it's vigorous sex with the woman on top. In other words, with the woman in control.
Driving.
That's right.
Yep.
No-brainer. Most people with penises have very little control over exactly when they ejaculate. This is partially because it does not involve the brain. The signal to ejaculate comes from the spinal ejaculation generator.
Which was why the brain dead guy could still get it on.
This region in the spinal cord coordinates the necessary functions.
Yeah, you don't have a whole lot of it's just like I can stop breathing. Breathing is involuntary, but it has a voluntary component.
Right.
Like I can hyperventilate on purpose. I can stop breathing on purpose for a little bit.
For a little while, yeah.
And then you're going to start breathing again. Same thing. You can start doing calculus in your head, but that's about what it requires.
Yeah.
And the spinal cord's still going to go, I'm going to go bust a nut no matter what.
Yeah, spinal cord doesn't care.
Hell with your derivatives.
That's right. Oh, my God.
Number 8, the angle of the dangle. A penile erection can point in virtually any direction. 0 to 30 degrees, 4.9% of participants. 30 to 60 degrees seems to be the most popular at 29.6% participants. 60 to 85 degrees, 30.9% of participants. 85 to 95 degrees, 9.9%.
Where are they measuring this from?
I don't have any idea. So for anyone concerned that their chap is a bit skewed, don't worry, you are normal.
I think it means it's touching your navel.
Okay. Oh, okay. Yeah, I used to do that.
It says a curve up to 30 degrees is still considered healthy.
Yeah, it's actually better for you, I think. The we've talked about curvature of the penis. It increases the apparent girth with the person that you are having intercourse with. If you think about it, it makes sense. So if you have a perfectly straight cylindrical penis and you're going in and out, okay, so you have this sort of feeling of girth from the stretch receptors in the vagina or whatever orifice you're in with whatever partner. There's no judgment. So, but let's just say penis vagina for now. Now, if you have a slightly curved penis, then let's just say that the curvature points to the right. So the tip of the penis will point to the left, so it'll be slightly to the left. And then as you insert it, of course, you're going to get this sort of angular insertion that will push the vaginal walls apart, and then you get the tip of the curve, and then you repeat in the opposite direction, and so it actually feels to the nervous system of your partner that you have more girth because you have more apparent girth. So a little bit of curvature. If you're a guy and you've got a 20 to 30 degree curvature, you don't have pathologic Peyronie's disease, which is a different thing altogether. That's where you have a curvature that's caused by scar tissue, caused by a fractured penis, because someone was in control that probably didn't realize that you weren't completely fully engaged at the time when they thrust downward and bent your penis in half. But as long as you don't have that, if you've always been self-conscious about curvature, actually you're probably doing better for your partner than somebody with a perfectly straight member.
Number 9.
Oh, there's more. Okay.
Grower or shower. A study including 274 participants demonstrated that there is no correlation between the length of a flaccid penis and its erect size.
Really? No correlation.
Some start small and end up large. That's a grower, while some are large when flaccid and only grow a little. That's a shower.
Well, Thank you for
And
explaining
then number
that.
10, cornflakes prevent masturbation.
What?
I've never heard that before.
Oh! No, this is what Kellogg was trying to do, wasn't he? Wasn't that part of the thing? Was he developed these flakes?
Dr.
Yeah, go
John
ahead.
Harvey Kellogg, the breakfast cereal mastermind, hoped that they would. He invented cornflakes and other products because he thought that the plain foods would lead Americans away from the sin of masturbation.
And didn't he have a camp or something like that?
Oh my God, how crazy is that?
There's a movie about it.
I'd never heard that. That's insane.
It's called The Road to Wellville. Story about the ins and outs of one unusual health facility in the early 20th century run by the eccentric Dr. John Harvey Kellogg.
He must
Talk
be a
about-
lonely man.
Eccentric doctors.
Yeah.
Do you know about the doctor that was involved with the Carter family?
No.
So I think he was the goat gland doctor. Let me see.
Like President Jimmy Carter?
Yeah, the Carter family. I'm sorry, the June and
the Carter fold. Yeah. Our Carter family.
Correct.
Here.
Our Carter
Our Carters. Yes.
His name was John Brinkley.
Okay.
And our son, Liam, interviewed the granddaughter of A.P. Carter in this studio, and he really needs to publish this thing because she told some crazy-ass stories.
Oh,
and
bet.
they would take their jalopy and drive, just imagine, drive it down to Mexico where this guy had a radio station, but not just any radio station. It was right over the line because the laws in Mexico were different. He was running 1 million watts. Now, right now, the strongest AM radio station in the United States is limited to 50,000 watts.
Oh, wow.
He had 1 million watt AM radio station. And so the Carters would go down there, and people said they could hear radio in their fillings.
Oh, gosh.
Or their fences.
Oh, my gosh.
Because the fence would refract.
I believe it, yeah.
Or what's the word I'm thinking of? Where a diode. It's not refract. But anyway, it would detect radio signal changes in the amplitude in these radio signals, and it would be translated into audio that people could hear because it was so powerful. And this station could be heard all through the Midwest of the United States, which is why the Carter family became so popular because people would listen to this radio station. I think it was XER was the call sign, and they had this huge audience. They'd be down there for 2 weeks, maybe a month, and they'd play every night.
Yep.
And then people were hearing this music that they'd never heard before. You know, A.P. Carter would go up and down the hollers just collecting songs from all these people just playing music on their porch.
And out over there where they were from, there were no paved roads. They were all dirt and gravel roads. I mean, I can't imagine that driving that.
If you're at all interested in the history of American music, you should go to Hilton's, Virginia, and go to the A.P. Carter store when it's open. Check it out. Just Carter Family Fold. Just search it on Google. Yep. But the stories that she was telling, but that was one of them. Now, this guy, this Dr. Brinkley, was also the goat gland doctor.
Wow.
And he, his thing was, because we were talking about erectile dysfunction, he wanted to do xenotransplantation of goat testicles into humans as a treatment for male impotence. And
man.
Yeah, and he got taken down by somebody whose name you've probably heard. And let me see if I can find it. Oh, now, okay, let's see. I don't want to. This page is just okay. Morris Fishbein. He was a famous attorney back in the. You maybe might have. I think they've made some movies about him as well. But 1938, Mo Fishbein entered the picture with vengeance, publishing 2-part series called Modern Medical Charlatans that included a thorough repudiation of Brinkley's checkered career. So even back then, they were trying to stay on top of quacks and weirdos and stuff.
So goat testicles?
Yeah.
Isn't that interesting?
Makes sense.
Yeah, perfect.
They didn't know anything about rejection and stuff.
No, I was going to say, I don't think that would have taken very long to figure out, though.
Right.
Yeah.
Can you imagine?
Yeah.
Topic number 2.
Okay.
Oh, here we go.
Yay.
First human to receive Neuralink implant says it lets him play Civilization.
Right. Okay, this is fascinating.
29-year-old Nolan Arbaugh, a quadriplegic, says the brain implant has allowed him to play chess and Civilization on his PC using his mind. I'm so freaking lucky to be a part of this, he says. So he received Neuralink's brain implant. Says, of course, it changed his life for the better. And he can use a computer simply with his mind. In a live stream on Wednesday, Neuralink introduced 29-year-old Nolan Arbaugh, a quadriplegic who agreed to receive the brain chip back in January. This is of 2024.
Yeah.
He's since been using the implant to remotely control a mouse cursor on his computer. He lost his ability to use his limbs after a freak diving accident about 8 years ago.
Oh, that happened to a friend of mine.
So he's paralyzed from below the shoulders, and he has no sensation or movement below his injury.
And that's something. So this is the beginning of the chips in the head trope, you know, from science fiction. Yeah. If you want to read a really fun book about the ideas that people have about how far this could go read a book by John Scalzi called Old Man's War, where all of those people have these implants and they have a computer in their head and they can access data and stuff like that. So it's fascinating.
The implant works by reading the brain signals from the user and translating them into Bluetooth-based remote commands to control an electronic device like a mouse cursor.
Yeah, you know, and this is just controlling a mouse cursor. That's a joke, 10 years from now.
Yeah, this initially involved trying to move his hands even though he's lost ability to use them.
Yeah.
So.
Incredible.
Wow.
Isn't that cool?
Yes, that's really cool. Good. And that's Elon Musk. So people that shit on Elon, he's still doing some interesting work over there.
Yeah. So topic number 3.
Oh, my goodness.
I mean, I know, but people were sending them to me.
That's good stuff.
Yeah.
Saying the F word and flipping the bird can reduce pain.
There you go.
There you go.
Swearing is not uncommon when you are in severe pain.
Right. You hit your hand and you shout the
Mother
F
scratcher.
And the C word and all kinds of stuff.
A recent study explored whether saying the F word or flipping the bird affects the experience of pain, and the results showed that taboo acts appear to reduce pain perception and increase pain tolerance.
Are they really taboo? I mean, is it that they're taboo, or is there a part of the brain that is stimulated when you curse? The reason I ask this is people who have strokes that affect the speech part of their brain, and they have a thing called Broca's aphasia. They know the word, but they can't say it. Many times they're still able to curse.
Right.
And they go, oh, shit, oh, shit, oh, shit. That comes out just great. Everything else, not. So my hypothesis is that curse words are stored in a different place in the brain.
Wow.
And it's probably adjacent, but it's not in the same place. And I wonder if that's got something to do with this, that when you do that, it somehow releases endorphins or something.
Pleasure center, maybe.
Or maybe it could just be or that.
Yeah.
Because it is pleasurable to curse, that's for sure.
Yeah. I mean, there's a lot of fluff in this article, but the takeaway is the hypoallergesic effects of swearing or giving the middle finger might be mediated by more effective emotion regulation. Additional research is needed to validate this hypothesis.
Yeah.
Well, but to go back to the pleasure center, those things, going back to the penis thing, you talk about after an orgasm, you tend to, let some
what do you do?
Salty
Do you
words.
cuss?
Salty words.
Oh,
buddy.
shit, oh, shit, oh, shit, oh, shit, oh, shit. Here it comes, Myrtle.
Look out, Myrtle. Here she goes.
But, and the other thing that's interesting, okay, this is an interesting phenomenon. I don't recommend that anybody do this, but if you are a stupid kid and the only thing you've got to help your, to lubricate your hand is
Get your hand off my penis!
Cornflakes.
Is like Vicks VapoRub that's got menthol in it.
Oh, goodness.
When you're doing the act, it just is kind of a warming effect. As soon as the transaction is complete, it's abject pain. So there is a switch that goes off in your head. We know oxytocin is released. so that that the trust hormone for that moment, you have complete regard for the other person, no matter who they are, just for a second, and then you go, "Oh shit, what did I just do?" Well, sometimes, and then you have this weird thing with this pain thing that changes. Now, I wonder if women have that. Now, I know a million years ago when we had. When we were cutting up peppers and stupidly tried to have intercourse afterward.
Well,
and then it's like, did you use warming lube? And then it's like, oh my God.
Yeah.
That only happened once, didn't it?
No, twice.
Oh,
happened
he's
twice.
a fucking idiot. He's a fucking idiot.
Yep.
Oh gosh, Tace, you are a trooper.
Well, we don't have to worry about that anymore. Anyway, all right.
Right on.
So, you got anything else on that, Tace? Those are good. Okay,
those are great, Tace.
Yeah, you get a bell.
Give thyself a bell.
I would actually agree with that bell for the first time ever. By the way,
there you go. All right, I've got one here that's just labeled body parts. I probably should run the.
Number one thing. Don't take advice from some asshole on the radio.
Let's just do this and see what this is. Now, all right. Come on now.
Come on now.
Okay. So powering, this is MT Daily again. I got cut off before.
Oh, sorry.
Electricity powering something off of a crematory.
What? Okay, I think we answered his question. It was about cremation before, so I'm going to get rid of that one. Okay. Let's see. Here's one from March 16th. Don't know what it is.
What year?
Yeah, good question. No, this is from this year.
Hey, Dr. Steve, Dr. Scott, Tacie.
What's up?
This is Tony from New Jersey.
Hey, Tony.
I love your podcast. I listen all the time, and I really appreciate it.
Thanks, man.
The other day, I was watching a brand new documentary called After Death. It's about near-death experiences. And I've seen, read, heard some similar accounts before, but this is the very first time I've ever heard accounts like these from medical professionals.
Yeah, let's talk a little bit. We're running a little bit out of time. Let's talk about near-death experience. Common factor in near-death experiences, people see a tunnel and a light, and they move toward it, and then some people will experience. They may run into somebody and talk to somebody. Every once in a while, somebody feels like they had a horrible experience. They actually went to hell, and this happened enough times that a couple of researchers wanted to do some studies on this. So one of the common things that people say is that they see themselves floating over everybody, and they're looking down at what's going on before they float up and go into this tunnel of light. And it's a pretty common phenomenon. So what they did was they put a message where only someone floating over the scene could see it. And it was in red flashing lights, so you could not miss it. And there was a word on there. So if you were really floating, you would have seen this, and you would come back and say, yeah, I was floating and I saw this word, and it said fire truck or whatever. And during the study that they did, lots of people had near-death experiences, described the same sort of phenomenon. Not a single one of them saw could tell what the light was, or even said that there was a flashing red light or anything. So it is some kind of weird illusion that our brain does.
Wow.
Now, could it last forever? Sure. It could, even if it only in our time lasts a couple of milliseconds. For you in perceived time, it could last forever, and that could be, your definition of the afterlife. Who knows? But I'd love to know more. I'm going to find out sooner rather than later compared to the rest of you guys. So if I figure out a way to let you know, I'll do it. All right. All right, Dr. Scott. Well, before we get out of here, you had a question from the Fluid family. And by the way, if you want to join the Fluid family, you're welcome to do so. Just go to youtube.com/@weirdmedicine, and also turn on gifted memberships, because Myrtle goes in and gives out memberships, and Other folks do as well. We've got some new subscribers that we're going to. Let's go through those real quick, because I see several messages here that we need to attend to. So, Tickles is a new member. Welcome to the Fluid family.
Hey, Tickles.
Myrtle Manus gifted 10 Weird Medicine Dr. Steve memberships. Are only 99 cents, so it's not like she spent a lot of money. But she's up there in the hall.
Way to go, Myrtle.
And let's see here. And then we had Ordo Monstrum got his comment deleted. Why is that?
I don't know.
Ordo Monstrum, thanks for the $4.99. Dr. Steve feeds me cornflakes, then shows me spicy potato puppet pics, all in the name of science. This is correct. That is true.
Oh, my goodness.
I do that.
Yes.
All right. And I think that's it. Okay. So what do you got?
Right on. So, hey, Dr. Steve had a colonoscopy.
Who's this from?
This is from the King.
King of all diffs?
King of all diffs.
Okay. Who didn't show up in Largo, by the way.
Oh, it was a no-show.
Yep, but that's okay. I gave his ticket to the spouse of one of the performers, and that worked out okay.
Oh, cool.
Because they were real sticky in that place about letting people in.
Yeah.
Yeah, but it was fine. It was fine. It worked out perfect, King. So. But we'll see you at the next one.
Yeah, that's cool.
DabbleCon 2 in August in Rochester.
Oh, gosh.
Go ahead.
God, it sounds like a party in a palace. Anyway, so
if you went, you would have a good time. I'm just telling you.
Had the colonoscopy.
No, okay,
yesterday.
both of you. Okay, both of you.
Lord and lady, douchebag.
Hey, we'll stay here and fall down steps.
Let me tell you something. Every single time, some guy drags his wife to these things. And she's like, ugh, yeah, he dragged me here. And when I see him walking out, she's like, I had the best time.
That's good.
And this time, it was the opposite.
Yeah.
There were women who were dragging their husbands to this thing, and they all had a blast.
Right on.
So there you go.
That's
Anyway,
cool. Yeah, so anyway, had a colonoscopy yesterday, and my colitis has resolved. How did this occur?
Well, like anything else.
It got better.
Yeah, it just got better.
Yeah, good question.
Okay, next.
Thanks.
No, a
couple ways. Yeah.
I mean, colitis is just means inflammation of the colon. Now, if he means he had ulcerative colitis, that is unusual.
Yeah, that's different.
But I have seen it completely resolve. And one of the treatments that I've seen that has completely resolved some cases of ulcerative colitis was fecal transplant, which is weird. So they they take healthy stool and put it in a diseased colon, and sometimes that colon will heal itself. So it's very interesting. If anyone is interested in that, send me an email. I'll send you some studies on that.
Are they using that treatment before surgery?
They should be.
They should be, yeah.
But if you have a perforation, you don't want to be putting stool up there.
No, but
Crohn's disease patients, that's sometimes a problem. Yeah, go ahead.
But real quickly, but in all seriousness, for colitis, that inflammation, a lot of times if you just take away whatever the food is or the drink or beverage, sometimes it's alcohol, sometimes it's a food, whatever. If you can take that away, a lot of times it's colitis. And sometimes, Dr. Steve, as we all know, it's stress.
Yeah.
Reducing your stress a lot of times affects your colon, and that can help your colitis.
Lots of different kinds of colitis. Does he know? Is he still here? Is he telling us what kind of colitis he's got? Because there's pseudomembranous colitis that's caused by Clostridium difficile. It's caused by bacteria.
Yep.
There is
a single-cell organism.
That's correct. There's ulcerated. There's ulcerative colitis, which is autoimmune.
Yep.
Crohn's disease is a form of inflammatory bowel disease. And then, there's just infectious colitis that's caused by weird bacteria that your body clears and then it goes away. So I'm glad it's gone.
Yep.
Yeah, good job.
Good news.
Ulcerative, there's there's some of these things cause increased risk of having colon cancer and stuff like that. But if you're at increased risk of colon cancer, let's say you have familial polyposis, you're much less likely to actually die from it because you're aware that you're at high risk. So you will get your colonoscopy so they can treat you earlier. You'll catch it earlier. So,
all right.
I'm getting my cardiac calcium score done on Friday because, I had to come off the statins and everything. After all these years of Dr. Scott saying get off the statins, now I have to. And so we'll see. We'll, by God, see where I'm at if I'm,
Oh, goodness.
Yeah.
But you've only been off them for 3 weeks, huh?
No, well, it'd be a little bit longer than that, but I went down to once a week and I still had problems. So
we'll see.
Yeah, we'll see. Anyway, alrighty. Anything else?
Well, do
Nope.
All right, then. Thank you, everybody. I
Thank
appreciate everybody hanging out with us. Thanks to Dr. Scott. Thanks, Tacie. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemails and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap, and check out Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye.
Thanks, everybody.
See you guys.